Hello, and welcome to the pharmaphorum podcast. My name's Dominic Tyre, and I'm pharmaphorum's creative and editorial director. For episode 14, I spoke to Patrick Connor at AstraZeneca. We spoke about his company's focus on lung cancer, why the disease should be a priority for society, and what changes he's hoping to see in this area. This episode is something of a companion piece to the previous instalment of the podcast, where I heard from AstraZeneca's Paul Naish about the quality of online information available for lung cancer patients. You can find more details for both episodes, including download links and information about other instalments in the series at pharmaphorum.com/podcast. The pharmaphorum podcast is also available on iTunes, Spotify, Acast and Stitcher, where you can find and subscribe to it by searching for pharmaphorum. So, Patrick, thanks very much for joining the pharmaphorum podcast. I'm excited to have a chance to speak to you a bit. And before we get going then, I wonder if you can put yourself into context and just give a short introduction to yourself and your role at AstraZeneca.
Sure. Hi, Dom. My name is Patrick Connor, and I'm the Global Franchise Head for Tagrisso and our Tumor Drivers and Resistance platform at AstraZeneca. Tagrisso is a medicine that we have developed in lung cancer specifically, and it's a medicine we're very proud to say is setting new standards of care for a specific subtype of lung cancer, patients with something called an EGFR mutation. So obviously lung cancer is a specific focus for us, and we're very proud of the strides that we're making to contribute towards changing standards of care.
Thanks, Patrick. And I spoke, of course, to your colleague Paul Naish recently, looking at some research that AstraZeneca had undertaken around understanding lung cancer space and the information that's available to patients. So, building on that, from your perspective, why is it important to understand the lung cancer space?
Well, I think first and foremost, this starts with the unmet need. Lung cancer is the leading cause of cancer death worldwide. Every minute, about 3 people die from lung cancer. So clearly, this is a very important disease, and something that we should be addressing as the pharmaceutical industry, but also as the lung cancer community as a whole. So I think that the research is very important because it puts into context that if you really want to change survival, long-term survival for patients with lung cancer, of course you need to think about research and development and the medicine, but you need to think more holistically about the patient journey. What is their experience from that patient who is that person who is out there in the world who doesn't understand or doesn't yet know that they have a lung cancer or will have lung cancer diagnosis, through to understanding that they have the disease, receiving a medication, and what is the quality of care that they may subsequently receive, post-treatment. So I think all of that is incredibly important, and I think that there's very strong evidence to suggest that if you address each stage of the patient journey well, you're going to improve outcomes. And I think ultimately that's what we all want to do. We want to eliminate lung cancer as a cause of death, and to do that we need to think more holistically about patients. And I think that's what the research that you discussed with Paul is so important.
And I'd be interested to get your perspective on how society views lung cancer. I suppose, as you mentioned, lung cancer is the most common form of cancer worldwide. Do you think lung cancer is enough of a priority for society at the moment?
Well, I think there is a certain stigma associated with lung cancer. Oftentimes it's thought of as a smoker's disease. There's unfortunately a perception that if you get lung cancer, perhaps to be correct about it, it could be your fault because of lifestyle choices. I don't think the perceptions around lung cancer are the same as when we talk about other cancer types like breast cancer, for example. The reality is that lung cancer, while smoking is absolutely a key risk factor for the disease, while lung cancer as a whole is the leading cause of cancer death, lung cancer in non-smokers is the 7th largest cause of cancer death worldwide. So, it's potentially a disease that can affect all of us, and for that reason, I think we need to place more emphasis on it as a society.
And looking at, I suppose, pulling back and looking at the global picture for lung cancer, so clearly there's it needs to be a priority for all countries. and there's still, I guess, significant unmet need for treatments across all stages of the disease. But in terms of that significant unmet need, would you say that is that the same country to country, or are there particular hotspots, if that's the best way of putting it, for lung cancer around the globe?
There are definitely regional differences. I mean, it is the number one cancer killer worldwide, but if you think about the standards of care across the world, those can be vastly different. And that is not just about access to new medicines and new innovations. It really starts right at the beginning. So think of the undiagnosed patient. If a patient is diagnosed with cancer today, unfortunately, about 75% of them, or the vast majority of them, are identified in late stages of disease where the prognosis for these patients is much, much worse. And if we improve standards of care and enable screening to become more prevalent, to have the technology associated with screening be improved, and diagnose patients in much earlier stages say 1 and 2 of lung cancer, we would significantly improve outcomes and results for these patients. So to put it really into context, if you're diagnosed today with stage 4 disease, the chance of you being alive at 5 years from now is around 5%, so not very high. If the same patient was diagnosed with stage 1 disease, the chance of being alive at 5 years is 80% and higher. So purely by focusing on that as a standard of care, we can fundamentally shift how patients are treated and how they live with their disease, and hopefully see the potential for cure. Now that I highlight because the way that different countries address screening around the world is vastly different, and I think we have an obligation as a community within lung cancer to advance this. Then, moving on to once you have that diagnosis, what happens to you? I think that here, the standards of care are not the same everywhere. Some of that is purely about timing. Patients within countries like the US would have access to innovative treatments, sometimes years before people in Europe, in Asia, and other parts of the world. And so I think that there's more that we can do to sort of accelerate that and make sure that all patients are around the world, no matter where they are getting access to the very best therapies. And then, oftentimes for various reasons, socioeconomic reasons and others, once a patient is on therapy, are they getting the right follow-up with physicians? Are they taking care of things like nutrition? Are they getting the right financial advice to understand, what is this going to mean for a person living with lung cancer and their family if perhaps, that patient is no longer able to work or takes a significant amount of time to get back to work? All of these things I think are important in helping the overall outcome for patients, and unfortunately there's this disparity in that around the world, and that's something that we need to address.
And moving from there then, look at what your own company at AstraZeneca is doing, why would you say lung cancer is specifically a focus for AstraZeneca?
Well, I think it starts with the unmet need, and AstraZeneca is a company that we're a science-focused, research-based biopharmaceutical company, and our focus is always on where we believe our science can make significant impacts on areas of unmet need. And if you think about lung cancer as being the leading cause of cancer death, it has to be a focus. It's been a focus at AstraZeneca for many years. So quite some years ago, we were the first company to introduce a targeted therapy specifically focused for a subtype of cancer, the EGFR mutant population, with a drug called Iressa. And today we've advanced that and changed the standard of care again with our new medicine, Tagrisso, which is the new standard of care in EGFR mutant disease. I think other important advances that have been a result of that focus, we have an immuno-oncology product called Imfinzi, which is the first IO molecule to move into earlier stages of disease. And why that is important, as I mentioned earlier, is that if you move into earlier stages, you have you're now really changing the game in terms of what you can expect in terms of outcome, and potentially offer patients that chance for cure rather than trying to extend survival. We can really try to address and cure the disease. And that's really the research focus for us in R&D in lung cancer, is to move into earlier stages of disease where we think we have the best shot at eliminating lung cancer, ultimately eliminating lung cancer as a cause of death, going earlier and earlier to address the disease when we can really make the most impact. Of course, unfortunately, a lot of patients who are treated early will still progress, and so another focus of our research efforts is to make sure that as patients progress through different lines of therapy and through different mechanisms of resistance, that we can address those too with our science and with the innovations that are coming. Clearly, it's a focus for AstraZeneca. It has been for some years and will continue to be until we ultimately achieve those goals.
Mm-hmm. And from a business perspective, how much of your oncology business does lung cancer represent at the moment?
Well, it's a significant proportion, and actually, if you think about the growth of the company, we just reported our Q1 results. If you compare our results versus last year, there's significant growth across the business. I think a large proportion of that is oncology, and the largest proportion of the growth that we see within oncology is in lung cancer. And actually, Tagrisso now, our drug for EGFR mutant non-small cell lung cancer, is now the number one product by sales at AstraZeneca. So clearly, this is a significant pillar. Oncology is a significant pillar for AstraZeneca as a business, and lung cancer is the leading pillar within oncology.
And I think we've touched on some of the changes it would be we're all hoping we can see in lung cancer, but clearly there's a lot more to come in terms of both the unmet medical need, maybe changes in terms of screening, and hopes for the science to continue to advance. From your perspective, Patrick, what changes are you hoping to see in lung cancer?
Well, I think there's never been a more exciting time in lung cancer because of the advances in medicine and science that we're seeing, and it starts all the way through that patient journey that I mentioned. The advances in technology, our ability to screen, the potential for machine learning and having the job of the radiologist made so much more easy because they're being assisted by computers to diagnose patients in a more efficient way and at a scale that has never been seen before. The advances in blood-based diagnostic technologies, which are able to sort of identify the molecular characteristics of a cancer, and therefore we can line up the better therapies for that patients. I think if you look across lung cancer, which is not just one disease, lung cancer is not one thing. It's a collection of multiple diseases, and I think that there have been advances to really figure out, if a patient has, a specific type of lung cancer, how can we make sure they get the right medicine at the right time? And I think those advances have never been better. So, when you pull all of that together, I think that now's the time to really accelerate those advances. These are, oftentimes individual companies, organizations, societies that are making these advances, and I think if we come together as a lung cancer community and focus our efforts in a more holistic way, rather than thinking about parts of the journey, parts of the puzzle, or segments of the disease, I think that we can really accelerate the advances that we're already seeing. And I think that there's a very realistic chance that in the next 5 years we'll be talking about survival rates that have doubled versus today. And I think there's a very real chance that in the hopefully not too distant future, we will eliminate this disease as a cause of death. And I think when you put that into context of lung cancer being the number one cancer killer today, I think that's obviously a lofty aspiration, but that's something we absolutely should be shooting for.
Mm-hmm. No, absolutely. But just picking up on some of the things that you mentioned there. So in terms of the advances in technology, if you had to pick one to focus on as perhaps being the most exciting advance that you've seen in technology, and maybe the one that's going to have the biggest impact ultimately for patients down the line, what advance in technology are you most excited about?
Well, I think it's the ability to sort of integrate science across the entire patient journey. So it's actually no one thing. R&D, pharmaceutical companies, the scientific community, we will always be focused on trying to bring new medicines to patients. but actually it's about how you integrate that across the entire patient journey, from the undiagnosed patient through to the diagnosed patient, through to the patient who's subsequently treated and cared for. And I think that the most exciting advances now are how, at scale, we will be able to screen patients in a more holistic way. We've demonstrated that if you screen patients early, you will improve outcomes purely in almost a mathematical way. By diagnosing them in stages 1 and 2, you will change outcomes. And the advances that we're seeing now with machine learning, which not only aid the radiologist in sort of identifying where nodules may appear on a scan, and that's a complicated process, takes a lot of time. We've accelerated the time that can take, but actually make the diagnosis now. I think that's incredibly exciting, because it means that the millions of people around the world who are diagnosed with lung cancer every year, we can do that in a more efficient way. And then immediately with advances in diagnostic, we can very quickly identify what is the right medicine for that patient. And I think that it's the integration of those things that actually is going to make the difference.
And as you mentioned then, so now's the time to be seeing that integration to accelerate these advances in technology. Specifically then, what is AstraZeneca doing to make these changes, these advances happen?
Well, I think this is about partnership. So, we are an R&D organization who deliver new medicines to patients, and that's what we will continue to do, and we must do that. But we're also thinking very holistically about how we partner with professional societies, diagnostics companies, patient advocacy groups, etc., to think more holistically about their patient journey. So what can we do? What is our responsibility as a partner within this community to make sure that we're able to screen patients appropriately, to make sure that technology is making sure that we're actually identifying the patients. Unfortunately, a lot of patients who are screened today will either be diagnosed positive, there'll be false positives, and that's terrible, because that patient may then think they have lung cancer. Imagine you're a person today and who gets told you have lung cancer, and perhaps you have to go for a biopsy and other procedures, and only to find out that you don't have lung cancer down the line. That's an incredible stress for you and your family. And likewise, the reverse is also true. Imagine being told you don't have lung cancer and only to become much more sick later down the line. And I think that through partnerships, we can really support and help that, and we are working to do that. And on the other end, AstraZeneca is a company with tens of thousands of people around the world, with organizations that are working locally with the community. How can we leverage that and harness that to make sure that we're adequately supporting patients, patient advocacy groups, institutions, to make sure that the standards of care after the medicine are optimal and the patients are getting the care that they need. So I think that's just another way of saying that we need to think in a more patient-centric way, and beyond the research and development, beyond the medicine, to make sure that we're making advances that are necessary.
Well, Patrick, finally then, to sum up, I wonder if you can tell me, what does success in lung cancer look like to you?
Well, I think success, if we take a step back from this and we sort of imagine a world, all right, and imagine a world where an individual who may be symptomatic, may be asymptomatic, is able to, in a very simple way, be screened for lung cancer in much the same way as we routinely screen for other diseases, other types of cancer actually, and that with maybe a simple blood test, a physician is able to tell that patient, unfortunately you have cancer, you have lung cancer, you have a specific subtype of cancer. Imagine a world where once that diagnosis is made, we have the ability to deliver the right medicine to the right patient at the right time. And imagine a world where once that patient receives the therapy with a much better prognosis, because we've caught the disease early, that we're able to support them holistically, whether it's through education, understanding of the disease, building a sense of community amongst lung cancer survivors. I think that is, in terms of an action, is what we should be striving for, and I think would define our success. And if we do that, then the outcome to all of this is that I believe that, as I said before, there's a very real chance that in the sort of next 5 years, let's say by 2025, we could double 5-year survival for patients living with lung cancer if we focus on, a combination of all of those three things: screening, diagnosing patients early, giving them the right medicine, and then making sure that the standards of care surrounding the patients are what they need to be. And if we continue on that journey and continue to make strides and continue to double survival, ultimately we are going to eliminate lung cancer as a cause of death, and that's incredibly exciting.
Absolutely. It certainly sounds like it is indeed a very exciting time to be working within lung cancer. So, Patrick, at this point then, thank you very much for joining the pharmaphorum podcast.
Well, thank you, Dom. It's a pleasure, and have a good day.
And that brings us to the end of another episode of the pharmaphorum podcast, where this time around we heard from AstraZeneca's Patrick Connor about lung cancer. You can find more details of this episode, including a download link for the podcast and information about other instalments in the series at pharmaphorum.com/podcast. The podcast is also available on iTunes, Spotify, Acast and Stitcher, where you can find and subscribe to it by searching for pharmaphorum. And don't forget to visit our website to sign up for daily or weekly email pharmaceutical news and analysis bulletins. And you can also follow us on Twitter, where we are at pharmaphorum.